The fight against the dreaded HIV and AIDS in Nigeria seem not to be gaining the much desired awareness, as there have been reports of new infections. Since the inception of the Buhari's administration, not much has been done to provide testing, care and treatment for persons living with the virus.
People are no longer testing themselves for HIV. There's this presumptive feelings that people are negative. A lot of people think that they are negative, so there's no point doing the test. We are out here today to reawaken people's consciousness to know that it's important for them to know their status. Even if you are negative, you know what to do if you are negative, and if you are positive, you also know where to go.
HIV epidemic seemingly is downplayed country-wise. We cannot stop shouting it out that HIV testing, it's an entry point into stopping and reversing the trend of HIV.
Recent data by the AIDS Healthcare Foundation reveals that there are more women testing positive to HIV than men, but stigmatization has made it difficult for them to access treatment.
There is a very, very huge gap in testing. We've also found that more men are coming out to test and few women. But at the end of the day, we get more females being positive. And that's why we have to bring out this awareness. So many people do not know their HIV status.
People who are actually carrying the real burden of HIV don't come out in campaigns like this to get tested, especially the female population. So there are gender issues surrounding HIV testing, especially when it comes to community testing. So what we did differently this time is to ensure that we carry out advocacy, to ensure that those barriers that female population, the female gender face in coming out to get tested, especially in community outreach, we address those issues.
Nigeria is ranked second after South Africa with an estimated 3.1 million people living with HIV, but only about 800,000 are currently on treatment. Alima Fashakin, AIT News, Abuja.